Hello and welcome to our first video lecture series. This will be a series of short videos, none longer than say 10 or 12 minutes, most of them shorter. Our topic this week is preconception and interconception care, which is health care for people of reproductive age who are not currently pregnant. By the end of the module, you should be able to identify anatomy and physiology of the male and female reproductive systems, describe the nurse's role in promoting fertility awareness, discuss the importance of preconception counseling. It's really important to promote good health before someone tries to get pregnant. Identify indications for genetic counseling for childbearing people. That's very brief because it's a whole separate course. Genomics. Explore health promotion in the context of family planning. Understand factors involved in infertility. And we'll talk a little bit about the nurse's role in helping couples struggling with that issue. When we get to class, we'll develop plans of care using realistic case studies for individuals of reproductive age who are either planning a pregnancy, trying to avoid or delay a pregnancy, or struggling to achieve a pregnancy. And here's your table of contents. This video will include the first topic, which is reproductive anatomy and physiology. Now, if you're very familiar with reproductive biology, you can skip it. But when we start talking about infertility or contraception, which are important topics, it's helpful to know a little bit of basic information about how that process works. And it will also help you understand preconception health and fertility awareness. So we'll start with the reproductive anatomy and physiology. This is a very brief overview. Your book has much more information should you choose to explore it further, but we'll start with the male because it's a little bit simpler. Men produce sperm their whole entire lifespan and are capable of reproducing at any time. So it makes it a little bit easier. The sperm is produced in the testes. There's a testis that also secretes testosterone, which is responsible for male sexual characteristics, and it's important to support reproductive viability. There are seminiferous tubules in the testes where sperm is produced. The testis connects to the vas deferens, that highway, by the epididymis. Eventually, sperm travels down the urethra and out of the body. And I'll give you a 9-second video of how sperm is produced. Okay, so you saw how that kind of works. Eventually, it is ejected out of the body. And we have a little drawing here of the reproductive system. I did not provide pictures of the external female genitalia because it's kind of outside the scope of the rest of what we're going to do. Just the internal structures. The vagina is the pathway between the external female genitalia and the uterus, and it connects to the cervix. Cervix here is an opening of the lower segment of the uterus. It allows sperm to travel in. It allows a baby to come out. It secretes mucus here. During ovulation, that mucus becomes very favorable to sperm. It helps it move better and protects it from being destroyed. Outside of ovulation, the mucus becomes a little less favorable. So, 250 million sperm, approximately, are deposited in the vagina with an active unprotected intercourse. If they travel through the cervix, they go up through the uterus and into the fallopian tube. At the same time, if it is during the time of ovulation or 24 hours after, an ovum is released into the fallopian tube from the other end. And in this middle third, the ampulla, is where fertilization takes place. Now I want you to notice something. Here at the isthmus, that's where it connects to the body of the uterus. It's a little bit narrower, right? So if there's any kind of scarring or damage to those tubes, sperm can't get through. And then we have the infundibulum. This is the outer third of the fallopian tube. You see it has little finger-like projections, and they sort of propel the ovum to go to the right place, into the fallopian tube and not out into the abdominal cavity. The ovaries store all of the primordial follicles that can develop into mature oocytes. They're about the size of an almond. They are not attached to the fallopian tube. They are adjacent to it. They have ligaments that support them here so that they don't really go anywhere. They can't travel. In its non-pregnant state, the uterus is the size and shape of an inverted pear or your closed fist. And it's pretty remarkable when you think about a woman having a 9-pound baby with a big placenta and some fluid, how it can grow to accommodate that, and then over a period of 6 weeks, shrink right back down to its normal size. Now, with childbirth, this cervix will change from being perfectly round opening or a little like smiley face kind of opening, dimple, to a more raggedy star-shaped opening, because when it stretches to allow a baby out, it does, sustain a little bit of trauma, usually. And so if you were to look at that cervix through a speculum, you would see that star-shaped appearance, a little irregular. Let's talk about the physiology now. The ovarian cycle is divided into 2 phases. Now, I hate that they always give you a 28-day cycle because it's a misleading picture. A normal ovarian cycle can be anywhere from 21 to 35 days. It starts on the first day of menstruation. The follicular phase can vary, and this is where a lot of people maybe don't realize the timing of ovulation. If you have a 21-day cycle, it will last 7 days. If you have a 35-day cycle, it will last 21 days, because the luteal phase is fixed. It's predicated on an ovum after it's released. Some women, it takes longer for their follicles to mature. Some women, it's shorter. So the follicular phase can vary. Starts with the first day of menstruation, lasts until ovulation, and then the luteal phase takes over. So the process. Here's an ovary with a bunch of primordial follicles. Women are born with all of those primordial follicles already in place. They are in a state of arrested development. They go through meiosis 1 when they are fetuses. And as they go through puberty and start to ovulate, these follicles mature, develop. And in the follicular phase, as I said, starts on the first day. Bleeding length varies from woman to woman and cycle to cycle. So when you're counseling people who are trying to get pregnant or people who are using natural family planning, that's important to remember. FSH is a hormone from the pituitary. It stimulates the development of 5 to 20 follicles within that ovary. Each one contains that immature oocyte that has not developed. The follicles themselves will secrete estrogen that help prepare the uterine lining for implantation. So it's important to release multiple follicles, but typically only one will fully mature and proceed to ovulation. Now, some women have double ovulation, and that's how we get fraternal twins or dizygotic twins. Some women, under the influence of fertility medications, will release many follicles that mature and are available for retrieval. So here we have the surge in LH, which triggers ovulation. Follicle ruptures, the oocyte is released, it travels through the fallopian tube into the ampulla, can be fertilized for 24 hours. Sperm can live in the female reproductive tract for up to 5 days. So again, people trying to achieve or avoid a pregnancy might want to know those things. That they have about a 6 or 7 day window, usually. The luteal phase, that's the second part of the ovarian cycle. After the follicle ruptures, it forms this little body called the corpus luteum. It sort of looks like a halo around the ovum. The corpus luteum secretes progesterone, the hormone of pregnancy. Pro meaning for, gest is the root of gestation, which is pregnancy. So it sustains itself before it can implant. The body temperature will rise slightly at this point in the ovarian cycle to increase metabolic activity in support of pregnancy. If fertilization doesn't take place, if the hormonal signals don't get to the corpus luteum, it will start to self-destruct. Then it won't secrete progesterone, and that drop in progesterone will trigger the shedding of the uterine lining about 3 days later in menstruation. The luteal phase has a fixed length of 14 days. Okay, and here I'm going to show you a picture. We start on the first day of bleeding. Follicles start to develop under the influence of FSH. Then there will be a mature follicle. Surge of LH, luteinizing hormone, makes it rupture. It's able to be fertilized for 24 hours, it will start to develop the corpus luteum after that 24 hours, which secretes progesterone until it realizes that the body is not actually pregnant, and then it will start to disintegrate, and the uterine lining will shed. These videos like to play over and over again. Okay, some terms that relate to ovulation. I do not test on these terms, some teachers do, but they are helpful in explaining fertility and the signs of ovulation to other people. Mittelschmerz is a crampy, twingy feeling on one side of the abdomen. It coincides with ovulation. This can be especially pronounced if women are taking fertility medication. Spinabarket is the stretchy quality of cervical mucus that coincides with ovulation. If you want to know what spinabarket looks like, crack an egg into a bowl, dip your fingers into the white of it, not the yolk, and then stretch your fingers out. It should stick to your fingers and form a thread that's about 2.5 inches long. Cervical secretions will do the same thing during ovulation. They will gradually become stretchier and more clear. This helps sperm move better, makes the uterine environment more hospitable. And it's a way that women can know that they're fertile. They can check using a piece of toilet paper or their fingers to see the quality of their cervical mucus, and they will know that that is their fertile window. Now, they have to be careful for 4 to 5 days before that because sperm can live that long, which makes NFP a little bit tricky. But we also have a uterine cycle, and this is how the uterus prepares for a fertilized ovum to implant, a blastocyst, actually. That's what implants. It begins about day 5 of the menstrual cycle. As the follicles are developing, they're secreting estrogen, and that makes the uterus thicken its lining. Cervical mucus will become thin, clear, and stretchy. It also becomes alkaline, and that's important. Women who have acid pH in their vagina normally do not want to use like any vinegar preparations or anything like that if they are trying to conceive. That does not make vinegar and water douching a contraceptive. 250 million sperm versus a little bit of vinegar, it's not going to work. But anyway, it should be alkaline. And there are things that you can do to manipulate cervical mucus. Robitussin, cough syrup, or it makes the cervical mucus, just like it thins your respiratory secretions, can also help thin the cervical mucus if you have somebody with an issue there. The proliferative phase kind of goes with the follicular phase. It varies from woman to woman and cycle to cycle. And the secretory phase begins with ovulation and continues till about 3 days before menstruation. This is when the uterus grows its lining. When the supply of progesterone drops off, the uterine lining is shed and vaginal bleeding occurs, and the whole thing starts all over again. Okay, we're going to take a break here. That's probably the longest video you'll have to sit through. And we're going to pick up with the real work of nursing.